Hey, what's up, everybody? Just making a little video thing, I guess, a log or whatever. I had stem cell therapy yesterday, where they took a hollow nail and drove it into my pelvic bone, and they sucked out a bunch of bone marrow. They spun it in a centrifuge, split it all up into what they needed to split up, which is the stem cells. They got three cc's of stem cell, uh, and they put it right back into my hip, um, where I have early stages osteoarthritis, and um, that involved trouble walking on uneven ground. Couldn't do stairs that well. Um, Trouble at work. Uh, Pain every day for the last about 2.5 years. Um, I thought it's worth it to see if I can, maybe get some kind of help. So uh, this is day two. Day one, I think it was maybe just the freezing, but because of the freezing that they used to do the harvest, and do that because it was kind of barbaric in a way. That probably gave me the numbness in my leg that felt good. Um, Day two, it feels a little worse because of the trauma where the needle went in, um, and the other site where they re-injected the stem cells in. Now, apparently, they harvested a good amount. 3 cc's is pretty big. They usually only get, two and some change, but three is pretty good. It was thick, so he had to do a little bit more as far as suction goes. So it was a little uncomfortable. I was awake for it, so he was. It was Dr. JC in Windsor. He asked how I was, like, several times during it, which, his bedside manner's awesome. The guy's brilliant, right? Um, so it all went down basically, within a couple of, well, not a couple hours, about an hour, with everything waiting for the freezing, and with they have to spin the bone marrow for a certain amount of time. So they it takes about 20 minutes. So I was basically laying on the bed, for about an hour, right? I got up after they harvested and moved around, and it was okay, So it was, all in all, it was, the experience was, it's I would do it again, because if I had to, I wouldn't just do it for the fun of it, but I'd do it again. I don't really have that much pain. I just have kind of an ache right now. My pain that was in my hip from before, the next day now, is, I would say it's probably about 20-30% better already. They say that I'll notice more with in 2 to 6 weeks time. Now, in a month, I go back for a PRP injection, which is platelet-rich plasma. So they just take that out of my arm, with blood. So the blood goes in the centrifuge. Same things. They spin it, and they take it out after 20 minutes, and they re-inject it back into my hip, where they injected my stem cell. So it acts as like, kind of like a turbo, or it acts like a, something that's going to help it, do its job a little bit better, or like bump it. They say, right? So, um, so that's in a month. I'm gonna do these little things here and there, record. It's my first time doing this stuff, but whatever. I'm just gonna record it, and then we'll go from there. We'll see. I'm kind of the guinea pig. I don't know anybody else that had this specific procedure done. And Dr. JC is actually pretty new to it. He's about a year in. So he doesn't really have a lot of huge success stories from it, but I mean, there has been, I've researched, and there has been huge success stories. all his patients have been successful except for one, and it was because the patient was older, and he probably didn't harvest the quality of stem cells that he could have if he was younger. So just like any body, you produce more stuff when you're younger than you do when you're older. You start, losing stuff, right? Eyesight, hearing, hair. You start losing stuff, right? When you're young, you got all of that. So it makes sense if you if you do the math, right? So, that's about it. I'm doing okay today. A little bit more sore, but I think it's just from the injection sites. But I don't know. It feels better already. I'm not as it's probably the extra fluid in the joint too that's helping out. But the extra fluid in the joint are stem cells, and they're undefined. So they might be working as we speak, trying to fix what damage I have going on in there right now. Um, so that's about it. So far, it's been pretty positive, and hopefully, I have more to report. And I'll be skipping and hopping in the next 2 to 6 weeks. So that's about it. Thanks for listening. If anybody's watching, see ya.